So I just want to have a quick conversation about lower back pain. What I'm finding at the moment is people that are coming to me with lower back pain, it's typically soft tissue referral from the hips. So I'm going to quickly walk us through a few stretches and a few mobility techniques that are going to help relieve that pain. There are 2 or 3 of you that have been waiting for this video to happen. Thank you very much for your patience. So, first order of business, we need one of these bad boys. This is a lacrosse ball. Not everybody plays lacrosse, has one of these lying around unless you're a hardcore CrossFitter. You can get a tennis ball, cricket ball, maybe a spiky chew toy that your dog has, whatever works for you, as long as it can roll about. We're going to take this ball. Hopefully this doesn't get too weird for anyone. We're going to find a fleshy kind of channel in the hip capsule here. Not in the hip capsule, around the hip capsule. What we should find is it's quite bony here, it's quite kind of bony here, but there's nice and minty here. Take the ball and just place it underneath that area. It should be almost like a channel. It should be, it should feel quite natural for the ball to settle into that area. And you know when you find the spot because it's going to bloody hurt. Take your leg up and just move side to side. Use your arms to support you, but don't let them support you too much. Just iron out the kinks. There is a lovely muscle in the hip capsule or around the hip capsule called the piriformis. That bad boy gets super tight if you don't give it attention. And that can be a cause of this referred lower back pain. But what I'm finding is just hitting the whole hip all around, everything that plugs into that area. Stretch it out. We're going to do something right. As long as you're sensible, hopefully we'll find some relief. If you don't find relief, by the way, don't just stop at this video that I've made for those of you that have requested it. Go see a bloody doctor, see a physio. You know, talk to other people, get many opinions. One opinion isn't going to suffice when it comes to the back. You want to double check and triple check because the back is super, super, super important. Anyway, chuck that to the side. 4-point kneel. Anybody that's trained with me before knows this one well. One leg out, wrap it over, popping down into position. Now, this is easy. Chin to knee. That's medium. Watch the back leg. Arms out. That's hard. Rock from side to side and just hunker the chest down towards the leg. Find a position that works well, that is kind of a 5 or a 7 out of 10 on the pain scale. Nice. Popping through. Obviously do it on both sides. Leg forward. Knee out. Popping down, popping down, popping down, popping down. With a straight back if you can. Have a look at the angle of this back leg. It's relatively straight. Squeeze your glute to accentuate the hip flexor. I'll swap sides so you can see what I'm talking about. Hip flexors in here. Those of you that are doing a lot of sitting, either studying or driving, that's in a shortened position. It's at a 90-degree angle when you're in the seat. You're not moving around much. Over time, that bad boy is going to get short and short and short and short. So when you stand up, it's going to compromise the tilt, the position of your pelvis. If your pelvis is off, your back's off. Those two things plug into each other. We don't want that to be compromised. So really make sure that you're feeling it here. You're going to feel a little bit in the adductor. That's cool. But you've really got to feel it in the hip flexor. Move from side to side. Squeeze that glute. And just, you can tell that mine's quite tight at the moment. And just find a nice good spot where it's, again, a 7 out of 10. Hang out there for a while. Easing off. And another thing that I found is, this is me personally, if those things aren't quite working, I find that sometimes a super tight hamstring can impact things upline from it. So my hip, my back. If you've got a partner that you can run through this with, that's great. All you need to do with that partner is just lie on your back, leg up, and they can grab you here and just push the leg towards you. Make sure you communicate, and that's no drama. But if you're a bit like me, and you don't have many friends, you can take one of these, or a towel, or whatever's handy, maybe not an extension cord, wrap it around the foot, like so, make it straight, bring it through. Grab that band. With this one, I like to hang out in this position for about 20 seconds. After that 20 seconds, I'm going to push into the band. So my leg is going to really push out. My hamstring's actually switched on right now. 10 seconds. And after that 10 seconds, what you should find is once you relax and release, instead of being back in your original position, you're going to be more like here. It might be an inch, it might be a centimeter, but it will make a difference. You'll have a greater stretch, hopefully all the way from the base of the glute up into the back of the knee. Do that for another 20 seconds, 10-second push, relax, and pull through again. Please make sure you do these things on each side, on each leg, to keep shit even. And general rule of thumb is if you can hang out and work through each position for a minute 30, 2 minutes is awesome. You're really going to get optimum results. You don't see gymnasts hang out in positions of flexibility for, say, 10 seconds. You don't see ballerinas hanging out on the bar for 20 seconds. It's a prolonged period of time to try and get optimum mobility results, optimum flexibility. The other really important thing to mention is breathing. I think every single client I've ever had will get into a position where we're working on flexibility or mobility and they block up. Hip position. I don't know if it's because they're uncomfortable or if it's because they're thinking too much or both, probably both. But you've got to breathe. If you don't breathe, you're going to be tense. That completely defeats the purpose of what we're trying to do. Take a breath, exhale, and let your muscles relax. Every time you exhale, let your muscles relax. So, those of you that this has been made for, or anybody else that's watching this and has gotten this far, if you have any questions after you do these stretches and it doesn't help your back, send me a message, talk to me about it, because we can personalize this process for everybody, or I'll refer you to the allied health professional that you need to see. Wicked. Thanks, guys.